Gout's a very common form of inflammatory arthritis. It's the most common, in fact. It's a disease that's metabolic because it's associated with increased levels of uric acid in the blood, and at a certain level these crystals will form in and around joints, and it's these crystals within the joints that set off the inflammation that cause the symptoms of gout.
The acute flares or attacks that people experience, that's really a symptom of the disease. The disease itself is the deposition of uric acid in places around the body where it just doesn't belong. And if you think about this in other ways with other diseases, it's as if a patient had a brain tumor and had a severe headache. So the focus on the headache and be able to treat that with some potent pain medicine is obviously important because you don't want to be in pain, but you're not going to address the primary issue, which is the brain tumor. And in gout, if you only focus on the flares of gout, you're not going to treat the underlying disease, and that's unfortunate because patients and physicians need to understand that it's getting rid of the deposits of uric acid, which is a lifelong effort that's successful treatment.
Those symptoms typically are a single joint being intensely inflamed and excruciatingly painful to the point that if it's in the lower extremity, the person suffering from gout wouldn't be able to walk. If it's in the upper extremity, the hands, the wrist, elbows, they won't be using that joint.
Well, you want to alleviate the attack, which can be with a non-steroidal anti-inflammatory drugs like prednisone, or it could be with colchicine. But the important realization is that the attack is just a symptom. So the real treatment is to lower the uric acid level in the blood low enough to actually let the deposits dissolve.
And these flares can last for 5 to 7 days typically, and then even without treatment they would disappear on their own. With treatment they might only last 3 to 4 days. And then there's a pattern of recurrence unless the uric acid is lowered by medication. And typically these flares will recur over a year and will repeat and repeat and repeat and become more frequent. And then the disease can pass into a phase where there's always pain there and joints can be destroyed unless it's taken care of.